Hi everyone. I'm going to present the clinical case of the reconstruction after severe concomitant injury of the eye, eyelids, and orbit. Primary plastic reconstruction of severe combined ophthalmic injuries is a complex clinical challenge in terms of getting morphofunctional and cosmetic results. Purpose: demonstration of the results of complex surgical rehabilitation of a patient with concomitant traumatic injury to eye, eyelids, and orbit. In our clinic, we have had a patient, 14 years old. In this picture, it is already 5 days after injury due to a road accident, and also primary surgical treatments of eyelid and corneoscleral injury. Objectively, upon admission, right eye's vision was 0. In the photo, you can see sutured wounds of the eyelids, face, upper eyelid defect 25 by 20 millimeters, deformation of the inner cornea, shortening of the horizontal size of the palpebral fissure. There is no patency of the lacrimal passage. Eye hypotonics is suited corneoscleral wounds. On the B scan, you can see gemophthalmos, retinal detachment, subatrophy of the eye, and anterior-posterior axis of the eye, 15.3 millimeters. On this slide, you will see computed tomography of the orbit. You can see fracture of the medial, inferior, and lateral walls of the orbit. Defect of the inferior walls of the orbit 2.05 by 1.0 centimeters. The eye is reduced in size. The vitreous cavity is absent. Diagnosis: corneoscleral injury, detachment of the medial ligament of the eyelid, damage of the lacrimal sac, coloboma of the upper eyelid, post-traumatic fracture of the lower, medial, lateral walls of the orbit, contusion of the orbit tissues of the 4th degree, condition after primary surgical treatment of the right eye. On the first stage of surgery, we did plastic surgery of the inferior and medial orbital walls. Then we did dacryocystorenastomy and plastic of the medial ligament, suturing of the to the periosteum. Then we did plastic restoration of coloboma, fixation of the upper eyelid levator of the tarsal plate. Closure of a skin defect with a free skin flap from behind the ear. On this photo, on the second photo, you can see patient before surgery. On the first photo, on the second photo, you can see the patient after 3 days after surgery. You can see vitalized graft of the upper eyelid. On the third photo, you can see 3 months after surgery, restoration of the eyelid anatomy and subatrophic eyeball. On the second stage of surgery, after 3 months, we did a restoration of a functionally and cosmetically unpromising subatrophic eye. Plastic surgery of the musculoskeletal stump and temporary eye prosthetics. This is a result. restoration of orbital cavity volume formed by maculoskeletal stump and temporary prosthesis. But existence of the dystopia of the inner corner. Of the third state of surgery, after 6 months, we did correction of cicatricial dystopia of the medial angle using skin Z-plasty and individual ocular prosthetics. This is the result in a corner symmetry, cosmetic correction with an eye prosthesis, preservation of the palpebral upper eyelid sulcus. Here. After fourth stage, this is fourth stage of the surgery. After 6 months, we did correction of the palpebral sulcus with a free dermal fat flap. On the third photo, you can see a result after individual eye prosthesis, correction of the inner angle and upper eyelid. On this slide, the result after 1.5 years after injury, good mobility of the maculoskeletal stump and good mobility of the prosthesis. Yes. On this slide, you can see the correct position of implant of the orbit according and to the spiral computed tomography here. And on the second photo, you can see condition of the dacryostomy of the in the rhinoscopic picture here. At the final stage, at the final stage of the examination, 1.5 years after injury, it was found that the width, length, and shape of the palpebral fissure did not clearly differ from the healthy side. The mobility of upper eyelid is restored, and the function of the lacrimation is preserved. There is a normal position and good mobility of the eye prosthesis. Conclusion: complex specialized rehabilitation using the achievement of modern reconstructive ophthalmic surgery allow to maximally restore the anatomy of the eye and function of its adnexa, to carry out cosmetic prosthesis with the achievement of a good aesthetic outcome. Thank you for